Good afternoon. My name is Vern Liebmann. I'm with HairClone and I'm the Director of Clinical Relations. Today, I'd like to welcome Dr. Jerry Cooley and a patient of his, Tommy Smith, to this conversation about banking and potential cellular treatments for regenerating hair that HairClone is developing. Good afternoon, gents.
Good afternoon.
Good afternoon.
I'd like to ask you why you originally considered a hair transplant, and I know that you've done one. Why did you go ahead with that at that time?
It's a longer story than you have time for now, Vern, but I'll give you two briefly. In my 20s, I began to lose my hair. The doctors I was consulting with couldn't figure out, is this just the androgenetic version of hair loss? In concert with that, I had had severe acne, ultimately culminating in severe acne scarring. I was in a point in my life where I was just beginning my work career, and I had lost a lot of self-confidence with my appearance. And so I sought out help for the acne scarring, and then I began to seek some help with the hair transplant. And so I found, fortunately, who I thought were the best of the best in the United States at that time to deal with both of these issues. And I'm happy to say by age 32, for the most part, the scarring and the hair transplants had been completed, and it certainly had a big boost to my self-confidence at that age.
Thank you, Tommy. This is a question for both of you. Let me start with Dr. Cooley. As far as banking of follicular tissue, what interests you about offering that for your patients?
Well, for me, it's part and parcel of my interest and belief in hair cloning. I actually entered the hair field as a dermatology resident when I was exposed to the research on hair cloning and regeneration, and I believed that this was the ultimate destiny of our field. And so I entered the field of hair restoration as a young dermatology resident, believing that hair cloning was imminent. And I've maintained an interest and obviously been frustrated over the years at the lack of progress and the lack of success, but also encouraged by the ongoing research. And so I believed in the hair cloning process. And really, for me as a hair transplant surgeon, one of the looming limitations of our field is the finite supply of donor hair and the number of patients who are experiencing hair loss but may not be candidates for a hair transplant. So the need is huge. I think most people are aware of that, and I believe the technology will come to fruition, and I believe it will happen, hopefully in the near future. So therefore, as a result of that, I believe that it makes sense to bank your hair follicles as soon as possible when you're as young as you can be, so that when that day comes, they will be ready to go. And that will expedite the process for those who are interested.
Thank you. As far as banking now, is there any scientific or biologic reasons that you've read or been exposed to that cause you to say, okay, it's better to bank now than wait a year, 2 years, 5 years?
Certainly, just the research I've seen is that all of our cells undergo aging and they become less healthy over time. There's changes to our chromosomes. There's changes to the cellular activity, the enzymes that function within the cell. I think we all know that as we age, everything kind of slows down. So the younger, the better. So if it's 5 years, I think clearly there's a benefit. If it's 10 years, even more so. So I tell people to, typically when I'm dealing with patients, they're already somewhat familiar with the research and the potential, and that if you believe in this research and you believe, like I do, that it's going to become a possibility, then it makes sense to consider banking.
Thank you. Tommy, do you have any comment about what interested you in banking some of your follicular tissue?
Vern, I've been a patient of Dr. Cooley since 2017 and been seeing him for various reasons, touch up and some other things. And when the banking of follicles became available, my thought was, I'm aging. I'm learning that some of the transplanted hair doesn't live forever, and that it would be nice to have a few hairs in reserve. To me, the benefit versus the cost was significant. It was a very easy decision for me. And then having gone through the process of banking, made that decision as clear cut as it could be, because as I learned through the banking process, I've tried to equate it to going to the dentist or getting your blood drawn. I can almost assure you, you will feel more pain getting your blood drawn and going to the dentist than you will the banking process. So I just saw it as a very easy decision to look into the future and know that there is potential for taking a few hairs. I think, Dr. Cooley, we took maybe 180 follicles, and knowing that could turn into many-fold of that, it really was a very easy decision for me.
Dr. Cooley and Tommy, I'd like to hear each of your thoughts about the potential of cellular treatments for rejuvenating miniaturizing hairs based on the cells from banked tissue and being able to bring those miniaturizing hairs back to life.
So my understanding is that the initial phase of the hair clone procedure would be an injection treatment that would be analogous to PRP or exosomes injected into the scalp. One of the limitations of those procedures is that the effect is temporary. Now, depending on the patient and their genetic programming and what medications they're on, we may get a year, we may get 2 years, but we know that those growth factors turn on genes for thicker hair for a limited period of time. My understanding is with the cellular injections, it's sort of a cross between PRP and a hair transplant in that it's going to be injection technology, but we're injecting donor cells that are not sensitive to DHT, and that these cells have the ability to attach to miniaturizing follicles, take up residence, and then reprogram the follicle to be less androgen sensitive, which means that you're resetting your genetics. So I see many patients in the early stage of thinning, or what we call miniaturization. They don't need a hair transplant yet, but they have widespread thinning. And if we could thicken those hairs up permanently with cellular injections, that would be a huge, huge breakthrough in the hair restoration world. And then it's also my understanding that someday we'll have the ability to create new follicles, and that for the patients who are already experiencing baldness, that instead of a hair transplant, we'll have the ability to create unlimited number of hair follicles, new hair follicles. So a two-step process in the research and application.
Tommy, do you have any thoughts about the potential for cellular treatments and how it might benefit you?
If you were able to invest the amount of money that it will take to complete the banking process, and someone told you, they realistically told you there is a chance that those dollars will turn into many-fold what the original investment was, most people, I think, would be willing to take the risk. And I've sort of equated that to banking. The amount that it costs and the number of hair follicles that you're banking can if this process becomes what I think we all hope and believe it certainly can be, the result is exponentially many more hairs than you banked. And so again, I say even at 65, when I'm well past my prime, if I were in my 30s or 40s, it would be an even easier decision as it was at 65.
Well, thanks for explaining that, how the cost-benefit ratio for you was something that was very appealing. Thank you very much for those comments. Tommy, Dr. Cooley, anything else you would like to say?
Dr. Cooley, if I may ask you a question as a physician, what, if any, downside do you see with this process?
The biggest thing is the uncertainty as to when it's going to happen, and I try and communicate that honestly to the patient. So anyone who is going to embark on hair banking needs to understand that we don't have any guarantees as to when this technology will happen. Someone who's going to bank their hair needs to understand the uncertainty, believing in the technology, but also recognizing the uncertainty as well.
You foresee 10, 15 years from now the potential for this process replacing, to some degree, or even to a full degree, replacing hair transplantation?
What I would see in the initial phase is supplementing and then replacing medication, because we want to, in the first phase, catch hair loss in the early stage. And we're using medication, lifelong medication that may have side effects, to preserve the hair. If we can get in and reprogram the hair follicles so that they don't thin, then that could potentially replace medication, which would be huge. Then as the technology gets perfected and we can start creating the kind of results we get with the hair transplant, then it will certainly move into that. But ultimately, I think it's going to be a while before the cell-based treatments are going to completely replace hair transplants.
As a patient, Vern and Dr. Cooley, I'm very excited about the potential of this. I would consider it very affordable. There's a lot to be gained, and I would say a fairly small amount to potentially lose.
Thank you, Tommy. Thank you for those questions, and thank you for your comments.